Hi, this is Nicole Simpson, and I am going to be demonstrating a skill on how to apply an NG tube. So first thing we're going to do is check the doctor's order to make sure that it's there. Also, we're going to check the record to make sure that there is nothing contraindicating um, for putting in the NG tube, and check for if he is on any anticoagulation therapy, because we don't want any bleeding, because sometimes putting in an NG tube can, I guess, cause some trauma, so we want to avoid that. So here we go. Hi, my name is Nicole. I'll be your nurse today. We're going to close the screen for privacy. I'm going to do hand hygiene. Hi, so today we're going to put in a NG tube, okay, because you have maybe an intestinal blockage. So I just want to kind of explain what's going on and how that's going to work. But before that, let me check your name, if you will tell me, please. So patient has stated name and then your date of birth for 2 verifications of identity. Okay. So we're going to put this tube in. It's going to go in through your nose, down your throat, and down into your esophagus, into your stomach. Okay. It's not a very pleasant experience, but I wanted to let you know that up front. Okay. So first thing we're going to do is have you blow out through your nose each nair. We'll have the patient do that to assess for patency, and whichever nairs has the best patency is the site that we're going to put the tube in. Okay. Also, we're going to do check the gag reflex. So we'll have the patient go go in and stick in the tongue depressor far enough to assimilate that. Okay. Patient has gag reflex. Okay, next thing we're going to do is offer the patient a drink. Normally, patients who need an NG are NPO, but we do want him to be able to lubricate the throat for easy feed down into the esophagus and stomach. So I'll have the patient take a few sips. Okay, great. Now we'll get everything else together for insertion. So we've got all of our equipment, NG tube. We don't have a 30 to 60 cc syringe, so I'm just going to pretend with the 10 that I have. So I'm going to open up the package. Can't see that. Let's make sure you can see what I'm doing. Okay, open the package. Now we're going to put on our gloves. It's a clean process, not a sterile one. Okay, and then we're going to measure the tubing. We're going to go from if I can get this to come on. Here we go. We're going to measure from the nose. You can see that. From the nose to the ear lobe, and then from the ear lobe down to the xiphoid process. And then we're going to mark that spot. We're going to use a Sharpie to do that. So right here. Okay, so there it is marked. And then we're going to use some lube. I have some lube from work. All right, so we'll get that out. Oh, didn't open it all the way. And then we're going to inform the patient that someone else is going to come in to help assist with this process. So, Mr. Johnson, we're going to have Amy come in. She's going to help with drinking water while the NG tube is going down. Now we're going to flush the tube to make sure everything gets clear. I'm trying to get this open so I can, there we go. Alrighty. So now we'll stick this through here. Put it in there. And we're going to flush the tubing. Okay, so that's all set. So the patient will have water to drink. Now I'm going to lube the tubing. You can see me doing that. Okay. And then we're going to go in the nose. We're going to aim toward the ear and kind of go, if you can see, like that. Okay. So, sir, here we go. Just go insert. Okay. And then swallow, swallow. I would have alerted the patient to tell me, raise a hand or something if the tubing is painful or something like that. That will indicate that we need us to stop. Go back toward that way, and then the tube is going to go down. We're going to keep going until, oh, I guess that didn't work. Go toward the alright. Until we reach the mark. Okay, so we're right here at the mark. We're going to hold it in position. We're going to get some tape. To hold it in place. We're going to split it off. Once we're at this point, we want to make sure that the tubing is held in place. And then we're going to wrap this around. And then we're going to go the opposite way. So the tube is secure. Also, during that process, before we actually fasten it and keep it secure, we want to check to make sure if we hear any air sounds or anything like that, because then we'll know that we're not in the right place, so we'd have to start all over again. And then once that is verified, we would then put on the full tape and attachment to the patient. And then placement of the NG tube will have to be verified through X-ray. So either X-ray would come to us or we would take the patient to the X-ray department. But after this is established, we would take our tube and either tape it to the patient's clothes, or if this tubing is bothersome and they like to pull people with cognitive impairment or mental health issues, things like that. We'd want to maybe tape it off to the side to get it out of their field of view. And that's it. So we're done with this portion of it. Next, we will offer oral care. So we can take out the tubette, open it up, and clean the patient's mouth, as so. Cheeks, tongue, teeth, all that. If the patient is able to do so, then he or she can do it themselves. And that's it. Then we'll remove the gloves, gather all of our trash and our belongings, throw everything away, perform hand hygiene again, check and make sure that the patient doesn't need anything else. And then we'll go back and we'll chart. We will chart the depth of the tube and how well the patient tolerated it. And that's it. So thank you very much.